between the ages of 45 and 55 with an average age of 51 years. It is advised to continue any sort of contraceptive use if you're sexually active during the menopausal transition, as ovulation can still occur until 1 year of absent periods have taken place. So what are some of the causes of menopause? So the number one reason is that it's just a natural process. It's a part of life. Every woman, as long as you live as long to see it, you will go through menopause.
That's right.
It may also be secondary to surgical procedures, for example, removal of both ovaries, as this will affect the hormone levels in the body. Treatment for certain conditions such as endometriosis, which is a problem affecting a woman's womb, as well as cancer chemotherapy, may also affect the stage at which a woman enters menopause. Use of anti-estrogenic agents, which are medications that act against estrogen, which is one of the hormones that fluctuates during the menopausal period. If you are taking any of those kinds of agents, then this may also affect when menopause occurs. So estrogen and progesterone are the two main hormones that we speak about when we're talking about menopause, and these help to regulate menstruation in the younger years. They are primarily produced by the ovaries, and at around the time of menopause, there's a gradual decline in the levels of these hormones, causing irregular periods and eventually a completion of the menstrual cycle. This is just a diagram that highlights ovulation as well as the menstrual cycle, and then at the bottom, diagram C, I don't know if you can see it very clearly, but it's it's for menopause. So as you can see, the estrogen and the progesterone levels, they fluctuate prior to the stage of menopause. As you can see, it's going up and down, and then around the time of menopause, it kind of plateaus and it decreases. So it's a fluctuation and then a complete decline of those hormones. And then there are other hormones as well that play a part. These are FSH and LH. These are just hormones that are produced by the brain, and those also help to regulate the menstrual cycle. So at the time of menopause, these hormones actually increase. So what are the signs and symptoms of menopause? So on the diagram, it's just a general overview of some of the signs and symptoms that you may experience, and it may be different for every person. So what may affect one individual may not affect another. So you have brain fog, depression and anxiety, dry eyes and mouth, sexual dysfunction, weight gain, dry skin and nails, bone loss, hot flashes, thinning hair, and we will go through some of these in more detail later on. So according to a cosmetic gynecologist in Jamaica, Dr. Bridgewater Lyons, a woman's genetics as well as her race or ethnicity, as well as culture and lifestyle affect the variability of symptoms and the time period in which a woman experiences them. Symptoms can last anywhere between 2 and 8 years, so it's a very long time. So just because your periods end after 1 year, it doesn't mean that the symptoms end. They may continue for years. Unfortunately, Black women are more likely to develop symptoms earlier and lasting longer compared to their Caucasian and Asian counterparts. So talking more on the signs and symptoms, so menopause is actually a clinical diagnosis. There are hormonal tests that can be done to kind of confirm the diagnosis, but if you are experiencing signs and symptoms and you've gone through a complete year of not having any menstrual periods, then it's safe to say that you have entered menopause. So I've classified the signs and symptoms here into 3 main categories. So for vasomotor symptoms, these are symptoms such as hot flashes, night sweats, palpitations, or feel like your heart is racing, and migraines. And this actually affects up to 75 to 80% of women, so it's very common. For the genital urinary symptoms, so these affect the genital tract and the urinary tract. These affect up to 50 to 75% of women, and these include vaginal changes, urinary frequency, meaning you're passing urine more often than normal and feeling like you can't hold it, that's urgency, dysuria or burning when you pass urine, recurrent urinary tract infections, and decreased libido or decreased sex drive. For the psychogenic symptoms, this occurs in up to 70% of women, and this may include anger or irritability, anxiety or tension, depression, which we'll speak about further, loss of concentration, low self-esteem, and insomnia or difficulty sleeping. So this diagram here shows the changes in the vaginal environment prior to menopause and after menopause. So prior to menopause, we have the ovaries producing estrogen as they should. The vaginal lining is usually thick and moist. It has good blood flow in the tissue. The vaginal walls are elastic, meaning that they have some amount of stretch, and they're rich in collagen, which is a type of protein found in the body. The vaginal fluid is secreted during sexual activity. There are folds and ridges that are present within the vaginal walls, and the pH of the vagina is usually acidic. On this side, on the right-hand side, these are some of the changes that you may have after menopause. So the ovaries tend to shrink, the estrogen production declines, the vaginal lining becomes more thin and dry. There may also be decreased blood flow to the vaginal tissues. The elasticity or the stretch decreases, and so you may have more painful sexual activity because of the dryness, the less secretion of fluid going on. You may also have the folds and the ridges that we spoke about earlier disappearing in the vaginal walls, and the pH being less acidic. So some of the skin changes that may occur from menopause include melasma, which is a darkening around the cheek area. You may also experience red skin, skin bumps or skin rashes, dry skin, and age spots. So some people complain when they come to the doctor, they say, oh doc, I'm getting all these random black spots on my body, and they have passed or they're in the menopausal period. This is just a part of the aging process. So nothing is necessarily wrong with you. These spots may just come up suddenly when you're at that age or at that stage. And this is just an overview of some of the things that you can do to care for the skin after menopause. So ensure that you have a good skincare routine to ensure that your skin is moisturized, hydrated. So don't just wash your face and go on the road. You have to put on a moisturizer. The skin is going to get very dry and it may crack. So you have to ensure that you keep up with your skincare. Also, sunscreen is very important. I know a lot of black women do not wear sunscreen because they think that skin cancer is only something that affects white people, but that's not true. So ensure that you're using sunscreen. Decreasing alcohol intake, and no smoking, exercising, and maintaining a healthy diet. Some of the complications that may occur as a result of menopause. On the diagram you can see here that you can get blocked arteries. You may also develop fractures or breaks in the bones, painful sexual intercourse, slower digestion, may also experience weight gain. And with menopause, there is an increased risk of certain types of cancers, such as uterine cancer, breast cancer, and cancer of the colon or the rectum. Decreased estrogen levels can result in long-term complications, and the most concerning ones are the cardiovascular diseases that affect the heart and osteoporosis, which affects the bones. So the rate of coronary heart disease is actually noted to be 2 to 3 times higher in menopausal women compared to women who have not yet entered menopause and are at the same age. Estrogen deficiency results in decreased bone density with an increased rate of bone loss of 3 to 5% per year for 5 to 7 years. So that is pretty significant bone loss over a certain period of time during the menopausal stage. So you have to be very careful that when you're walking, for example, you try not to fall, break your hip, that kind of thing, because your bones are not as strong. They become more brittle as you age. I don't know how well you can see the diagrams, but for the management, you have conservative management, which refers to management that does not involve medication, and then you have medical management, in where your doctor would prescribe medications for you for some of the signs or symptoms that you may have. So an overview of the management. For the conservative management, of course, diet and exercise is very important. Maintaining healthy stress levels as best as possible. Some people also consider doing aromatherapy, massages, yoga, things that will help them to relax. And there's also counseling. So you can get counseling from a medical professional. And there are also some non-hormonal medication options that can be taken. For example, a lot of women say that they take evening primrose capsules, which may actually help to decrease some of the symptoms such as the hot flashes that they experience. For the medications, I think the most common thing to note is that some women have to be on hormone replacement therapy. Remember that some of the hormones have decreased around the time of menopause. So sometimes you may actually have to be on medication to replace some of those hormones that you have lost during that time. However, hormone replacement therapy does come with its risks.